How to care for yourself before head and neck radiation. Your registered dietitian will help you with your eating and drinking before treatment. Eat a balanced diet with foods from all food groups: vegetables, fruits, grains, meat and alternatives, and milk and alternatives. If you are having pain or trouble chewing or swallowing regular texture foods, choose soft, moist, or blended foods. You can add sauces, gravies, oils, or butter to help moisten your food. Aim to drink 8 cups of non-carbonated, alcohol-free fluids every day. Keep your body weight the same. If you are underweight, try to gain some weight. Before treatment begins, you may be assessed by a speech-language pathologist to get a better idea of how you are swallowing. To keep you swallowing safely during treatment, some of your food and liquid may be changed. Follow the swallowing exercises provided by your speech-language pathologist. Start your swallowing exercises right away. Do each exercise 5 to 10 times per exercise, 3 times a day. Be aware of signs of swallowing problems, including coughing, throat clearing, or a wet or gurgly voice after eating or drinking, food feeling stuck in your throat, or need to wash food down with fluid, needing to make an effort to swallow, or needing more time to eat, trouble chewing food, and liquid coming out of your mouth or nose. To swallow safely, sit up straight when eating or drinking and remain sitting up for 30 minutes afterwards. Use teaspoons and take small sips of liquids. Alternate between small bites of food with small sips of liquids. Try not to talk while chewing or swallowing. And check that your mouth and cheeks are free from food after eating. You may be given other swallowing techniques to help you swallow as best you can. Your dental oncology team will help you with your mouth care before your treatment begins. Floss at least once a day with waxed floss. Use a soft toothbrush. Brush before bed. Gently brush tongue. And brush within 30 minutes of eating. Ensure medicated rinses are done 20 minutes apart, and rinse using the bland mouth rinse recipe. When rinsing, rinse, swish, and spit. Rinse several times after brushing, flossing, and eating. To make a bland mouth rinse, you will need 1 teaspoon of salt, 1 teaspoon of baking soda, and 4 cups of water. Mix 1 teaspoon of baking soda and 1 teaspoon of salt with 4 cups of water. Put the mouthwash in a container with a lid. Keep it room temperature and discard at the end of each day and make a new batch. Shake well before using. Rinse and gargle with 1 tablespoon and then spit out. Repeat 2 or 3 times at each use. And use mouthwash every 2 hours during the day. Remove your dentures, plates, and prostheses before brushing. Brush and rinse dentures after meals and before bed. And soak them in cleansing solution for at least 8 hours. If you are on antifungal therapy, soak in antifungal solution. Directions for use of fluoride trays. Brush and floss before wearing tray. Fill the grooves of the tray 1/3 full with gel. Insert tray and spit out any excess gel. Leave the tray in for 5 minutes. Use at bedtime for longer-lasting results. Brush trays and air dry after each use. Do not use hot water to clean trays. Hot water will distort the tray. Do not eat, drink, or rinse for 30 minutes after tray use. Inform your dental team if you are no longer able to use your fluoride trays. Moisturize nasal passages through the night with a steam vaporizer in your room. Moisturize with mouth rinse and water-based lubricants often. Avoid petroleum jelly and glycerin products. To care for your lips, use water-soluble animal or plant-based oil lubricants. Apply after cleaning, at bedtime, and as needed. Do not apply petroleum jelly. Helpful skincare guidelines from your radiation treatment team. Wash with mild, unscented soap. Bathe with warm water, rinse well, and pat dry with a clean, soft towel. Wear loose-fitting and breathable clothing such as cotton. Use water-based body lotions or creams to moisturize the skin as needed. Do not use aftershave or perfume products on your skin. Avoid products that contain petroleum jelly. Protect your skin from direct sunlight and wind. Wear a brimmed hat and protective clothing. Avoid extreme hot or cold temperatures. Do not use ice packs or heating pads, and do not soak in a hot tub. Use an electric shaver only. If you have a feeding tube, your registered dietitian and primary care team will work with you to manage your tube feeding and care. Flush your tube with 60 milliliters or 1 syringe of room temperature tap water 2 times a day, morning and night. To care for your tube, clean the skin around your tube daily and keep it dry. Clean the skin with a cotton swab dipped in water or gentle soap and water. Wipe away any crusting or drainage. Gently pat dry with a soft, clean towel or cotton ball. If there is a leak, cover skin with a gauze bandage. If there is no discharge, stop using a dressing. Check tube for redness, tenderness, a bad smell, or signs of infection. Signs of infections include fiery red, swollen, discharge, pain, or fever. Cover tube while showering. No baths, hot tubs, or pools. Do not use rubbing alcohol, peroxide, antibacterial lotions or gels on the skin around your tube. Tell your healthcare team if you think you have an infection or any issues with your tube, or if the bumper seems too tight or too loose.